consulting, projects, and training. Contact us for a free consultation.
Hi everybody, we are live. How you doing? Let's see. It's Monday, April 20th. I don't know what day it is. I used to say every day is the same to the self-employed, and now every day is the same to everybody. Welcome to our podcast. We are live today with Dr. Giles Morrison, and our topic is clinical UX puts the H in HCD. So we're going to have a lot to talk about today about clinical UX and a little bit about healthcare. But let's start by getting Giles's face up here because he looks better than I do. And oops, I've done it wrong. I put your name on this, and I didn't put my. Let's see. How did I do that? I put my name on it by mistake. Let me fix that. I am so funky. Okay, there you go. You are not Debbie Levitt. You are Dr. Giles Morrison. So introduce yourself while I get our chat room set up.
Hi everyone, so I'm Dr. Giles Morrison. I'm a clinical user experience designer and also a medical doctor. So I've been in the field for about 5.5 years now, after working as a doctor for 3 years. So as you can hear from the accent, I was born and raised in London, England. And then I spent my time working as a doctor in the United Kingdom, and then began my career in healthcare UX and digital health back in September of 2014. But now, as of October last year, I've moved to Germany, where I continue to work as a clinical UX designer, specializing in healthcare UX, and enjoying a little bit of the German sunshine, and still also trying to deal with this pandemic that's erupted the world.
Yeah, and are you comfortable sharing with everybody how you moved from being a medical doctor to working in UX? Because that doesn't sound like every grandma's dream.
That's right. It was quite a difficult transition, if I'm honest. Previously, when I was working as a doctor, as pretty much most doctors would agree, you do it because you want to help people. So you always come in with that attitude of how can I help someone else? And in that specific case of working as a doctor, how do I do this with modern medicine? Through having to use stethoscopes, sometimes having to stab people with a needle to draw blood, so on and so forth. And I still have that desire to help people. But there was definitely push and pull factors with working as a doctor. As I'm sure you can imagine and already understand, doctors work very, very long hours. It's very easy to work 12, 18-hour shifts sometimes if things are really, really hectic. And it's very routine that an 8-hour shift would become 10, 12 hours. And it's very easy, particularly when you work in the National Health Service, the NHS, that you would be moving around every year, new home, new hospital, and your life can be very, very disrupted. And I felt there's so much burdens that I'm putting up with, and also there's issues that my patients have that I can't really solve as a doctor. You know, it would be great if I had a career where I could be more involved with impacting the lives of many more people than just the 10 to 30 people I might see in a day. But then the draw and what pulled me towards at least digital health at a high level was the ability to work more of a 9-to-5 job, the ability to also utilize my skills in graphic design and computing and IT in general. And I thought, this is a really wonderful career. I never knew what UX was at that point, but I realized that I can still utilize all that I've learned and experienced as a medical doctor, as a medical student in a new role, and have a more fulfilling and rewarding job for myself, which made me happier. And I've never looked back since.
Fantastic. So some people might be wondering, clinical UX, is that the same as UX dealing with healthcare? But you were telling me you invented the term clinical UX. So tell everybody what it is.
That's right. So to make it a bit easier to understand, I thought I'll first go back to healthcare UX. So healthcare UX is a niche within UX and general UX, just like you might have people who specialize in UX in financial technology services, in e-commerce, so on and so forth. And healthcare UX, as most people would imagine, is the application of UX in healthcare. So how does someone get better healthcare services provided? How can they improve their health on their own? How can maybe even clinicians even use technology to provide a better service? So it's a very broad term, healthcare UX. It can encompass loads of different technologies. But to me, clinical UX is specifically around the application of UX that involves and impacts the lives of clinicians, and also has some impact, therefore, directly on the treatment of disease with patients. So here it's a lot more regulated. It is quite a lot more complicated, because it's one thing to help someone manage, what food that they're eating and track their diet and track what they're doing as exercise. It's another for you to be able to convince a patient that they can actually prevent, manage, and even treat their disease just using a mobile app. It's a lot more knowledge of medicine that you need to have, of behavior change, about the issues that patients are facing. But then also there's the flip side, what's going on with the clinicians that are looking after these patients. So it's a very, very niched area within healthcare UX, with healthcare UX being a niche within UX. So I see clinical UX as a niche within a niche.
For sure. And we already have some comments and questions in the chat. So just a reminder, everybody, if you're watching live, I'm checking LinkedIn and YouTube. Don't forget to subscribe to our YouTube channel. The redirect is deltacx.tv. We've got Prashant, who just says, wow, which I can agree with. And then we've got someone in YouTube who said, I think the name is Niku. And the question is, what are some qualities that a doctor may have that can be of use in UX?
Oh, wow. This is a wonderful question. It's one I get asked quite often. There are many transferable skills, knowledge, experiences that doctors have, and quite a lot of other healthcare professionals have, that are directly relatable to UX. Because ultimately, user experience, to me, I see it as the experiences that someone has with any technology or service they use, or anything that's been designed. Now, a UX professional, therefore, is looking at how can we make that technology, those services, easier to use, more accessible, more engaging. And ultimately, that's actually a problem-solving activity. There's a problem of, I want to make this better, I want to make this easier, I want to make this make more money, so on and so forth. There's a problem statement that you have, and then you have to go through a process of identifying the real issue at hand, the real problem that you want to solve. Furthermore, the best solution to that. So this is what doctors do day to day. You come in, you're like, oh, doctor, I've got this chest pain. That chest pain could be indigestion, it could be a heart attack, it could be pulmonary embolism, it could be pneumonia, so on and so forth. And you're going to go through a process of understanding what actually is the real problem that this patient has, make a diagnosis, and then offer the right treatment. And you're going to test to make sure that the treatment that you're given is best. So that whole problem-solving process that doctors and a variety of other healthcare professionals go through is completely transferable, like 100% transferable. The knowledge of, identifying a heart attack is not so useful in healthcare or clinical UX unless you're specializing on a product that deals with that. But it's the process of thinking, what are the different sources of truth, different sources of information, of data that I can utilize to feed into a problem-solving process. I think the other thing that's particularly transferable to healthcare and clinical UX would be actually that deep understanding of healthcare. Like any doctors that are watching this now who have done a night shift, they can relate to the fact of that sinking feeling that you have when you start the shift, especially if it's the very first night shift you've ever done, where you are convinced that someone's probably going to die during your shift. There's something about that experience, about facing death, about even bringing new life into the world, about having to deal with patients who you can't cure and you're just having to manage them for as long as possible. There's something about that experience which helps you when you're designing technology for people who also face those experiences. So even though you're not truly designing for yourself, you're still designing for others, because you've had some shared experiences. When designing for them, it becomes easier. I think another crucial thing as well is the fact that because you have worked as a healthcare professional, if you then work with other healthcare professionals on digital solutions or service design, there's almost instant trust because they see you as a kindred spirit. And I find that's quite useful in the work that I do whenever I'm working on specific clinical products. But I think those are the bulk of the key things that are quite transferable working as a UX professional if you come from a healthcare background.
Wonderful. Thank you. That was great. And Niku says thank you. And I want to say hi to friend of the show, Chinu, who has given you thumbs up. And so have a few others. So you have a couple of new fans. So obviously you've made clinical UX sound deep and interesting and exciting and like it's really going to change people's lives and change the world. How does somebody get into that? You know, someone like me,
Mhm.
I dropped out of pre-med in the middle of college. I didn't make it through. You know, could I still end up in clinical UX, or is it really for someone who has that domain knowledge?
I think the domain knowledge simply puts me at an advantage. You know, it's I've been watching this wonderful cooking show on Netflix recently with my wife, and there's a time when the families are cooking as three members of a family unit, and as they progress in the competition, they have to pick only one person to cook the meal rather than all three. And notoriously, they will pick someone who's got the most amount of experience. So it doesn't mean that the other two members of the family can't cook. It's just that they're drawing upon the additional experiences that someone has to be successful. But as you know, Debbie, and anybody else watching who works as a UX professional, very rarely is it a situation where if you only ever have one UX designer, it is truly just enough. Like there's almost always a benefit of having someone you could even just bounce ideas off if you're working on a new project. If it's just changing a login screen, perhaps that is easy enough to do on your own. But if you're making a new app, being able to get insight from a kindred spirit is quite useful. But then when you look at the that situation in healthcare, if you have someone who already understands, you know, what are the different stages of a clinical trial, understands why you shouldn't be taking this medication for patients who have already had surgery. You know, why is this patient who's just had a stroke at risk of getting pneumonia? You know, deeper insights on this is quite useful because, you know, ultimately when you work as a UX professional, there's always going to be questions that you cannot answer on your own. You're going to have to speak to somebody, read this resource, look at the data, do some sort of testing. The same thing applies for me. You know, I don't know absolutely everything about healthcare, but at least understanding some of the terminology is helping out. So if you
Right.
have a passion for healthcare UX, if you want to actually improve the lives of someone else through the application of digital solutions and new ways of working in healthcare provision, then that in itself is already a huge head start that you're going to have. And that passion is going to ensure that you answer as many questions as you need to deliver the best solution to the brief and for your client, for your employer, whatever the setup is.
And we've got a question again, Niku. I don't know if Niku is one of
Mhm.
your pals or a new pal to me, but welcome, Niku. Hope you'll subscribe.
Hello.
It says the message says, "What are some ongoing or future trends in healthcare UX? Where do you foresee opportunities for UX professionals to help both patients and doctors?" And thanks again.
Mhm. This again is a really, really good question. By far, the biggest place now for healthcare professionals to be involved in healthcare UX, and also for generalists in UX to get more involved in healthcare UX, would be in the digital therapeutics area. So, this I would still class as more of a clinical UX area because you're looking at applying user experience principles, designing solutions that directly improves the health of somebody. So, it's not just, you know, losing weight. It's actually thinking someone has actually got a diagnosis or needs a diagnosis for a mental health problem, or they've actually got a disease, a chronic illness, you know, inflammatory bowel disease, chronic heart disease, something like this. How can we actually diagnose them, treat them, manage their disease from home without having to physically come out of the door? And
Right.
crucially, only get escalated, you know, only get more medical interventions for this individual if they have a problem. You know, you don't actually need to provide for further treatment, have an outpatient appointment if there's nothing wrong with the patient within, you know, as in they've still got their disease, but they haven't deteriorated, they haven't gotten worse. So this area of digital therapeutics, which specifically looks at how can you prevent or manage, treat diseases through digital solutions, that is by far the biggest area. A lot of people still talk about telemedicine and the ability to actually access medical interventions and particularly have a consultation online. And that is still very important, particularly during this pandemic period with COVID-19, being able to speak to a doctor online or even just on the phone, let alone being able to use it web and microphone, that is still a big deal, because what a lot of people, general public, wouldn't realize is that most of a doctor's ability to diagnose a patient simply comes from asking them questions. They don't even need to examine them to have a final diagnosis, but most of the time, actually just asking questions can be enough. So telemedicine is still really important, but there's loads of players in telemedicine, and there's a lot of precedents on how to do it. We right now, I would rather you didn't ask me, to give you medical advice right now, Debbie. But we've got a
Does this look
website, we've got a
infected? That's my
microphone.
favorite question to ask a doctor as a joke. Does this look infected?
So anyway, we have got technology right now which could be of benefit, but digital therapeutics, like, there is nowhere near enough digital solutions that can truly prevent, manage, and treat diseases without the intervention of a healthcare professional, or at least without, a significant reduction of the involvement of a healthcare professional. This is where I think we should be putting more of our time and attention to.
There's something I wanted to throw in here. So I don't know if you've
Mhm.
seen this guy. So basically, this is a little device, and you can see by
Yeah.
the size of my hand how big the box is. And it's got an app, and it synchronizes with your phone, and it does
Mhm.
a 6-lead EKG. And
Mhm.
so I saw my cardiologist a couple of months ago, and I brought this to him to show him because I'm in the countryside in Italy, but he is like
Mhm.
the senior cardiologist at the hospital. And he
Mhm.
had just taken a real EKG on me, and I said, "Now look at this." And he's like, "Oh, do it, do it." So, we set up the app and we did it, and then he compared the results from this device to the EKG he just did, and in
Yeah.
Italian, his response was, "Holy shit." And then he was like, "Ooh, maybe I can rent these to my patients." So then he was having some capitalistic ideas. So that went off a
Yeah.
little
Yeah.
bit.
Yeah.
But have you worked with any devices like this? What's your thought on some of these devices? Which I assume this is meant to be more of a home monitoring. But I think that
Mhm.
eventually apps like these might try to give you proactive advice, like, "Holy cats, your heart rhythm doesn't look right. Here's what you
Yeah.
should do
Yeah.
next."
Yeah. Yeah. No, for sure. So I haven't actually used a device like that personally or professionally, but this is the future. We've talked about wearable technology as an industry for a very, very, very long time. And when Apple was checking heart rates years back with the Apple Watch, we were still already very much in deep and enjoying the idea and playing around with the idea of wearable technology. But it's one thing to have a device that can take readings accurately. So what's really encouraging to know is that your cardiologist recognizes that the technology actually works. That's really, really good. But the next step is then, how does this technology meaningfully prevent, manage, or treat disease?
He was
It's one
making it
thing for,
sound like he could just sit on the train or be somewhere or sit on a beach or
yeah.
whatever, and maybe there was a way. Now, I don't think there is. I don't think there's a way right now for this app to send information to your doctor proactively. I think you
Mhm.
have to export a PDF or I don't know what and get it to him. But he was
Yeah.
imagining that there was going to be some way. Because remember, I'm out in the country, and in order to go see this doctor at the hospital, we've got to drive 35 minutes on a 1-lane road and the whole thing. So he was
Yeah.
imagining that people who normally have to come in to be monitored would have something like this, could check themselves and kind of report in to him from a distance, which I thought sounded amazing.
Yeah. See, this is perfect. What you've taught is the service that wraps around this technology, because very often you'll find a lot of scientists, technologists, they will create a product which is in effect a solution, and they haven't fully found the problem to solve, or they're aware of a really, really good problem, only just looked at one part of the service that has to round this whole thing. And so it's people who are going to struggle, or it's going to be quite an inconvenience trying to regularly go and see him, if they can actually send their data electronically to him in a really sophisticated way. We don't want it to be clunky. We don't have to have it as, well, it goes to your app, then you download it to your device, then you attach it to an email and email it to the cardiologist. It would be great if it could just go automatically. In fact, what would be really good is if it could read the EKG or ECG, as I know, as in from the UK. If it reads it and actually recognizes pathology, recognizes a problem, and then decides that's when it's going to forward it, and only notify the doctor when there's a problem. The doctor could proactively have a look into your record at their will if you give them permission, but actually, this whole way of providing a service revolves around predominantly the idea of a personal health record. So many times when you get some sort of investigation or even just have a consultation with a doctor or other healthcare professional, they own the record. So everything has to be managed through the healthcare professional, and it's technology like what you've just shown that actually allows you to take more control over your health. That's the future.
And I want to show quickly, this is the size of the device.
Yeah, it's tiny.
It is. It is. It's really interesting. I think it's about $100, and you can get it on Amazon. I have no skin in the game. I don't work for this company. I don't make any money on this. It was a project. The company was considering working with me, so they sent me a couple of samples. We didn't end up working together, but I still find the device incredibly interesting, and I want people to know about it. We've got a new question in the LinkedIn chat from new friend Dr. Lisa, and then Chinu, we won't forget you. Dr. Lisa says, I had a telehealth visit for an abscessed tooth recently. I had to put phone in my mouth so the doctor could see. But she's also got a question. She asks, how do you think this changing landscape should affect customer journey efforts, given how much we know about attitudes, touch points? I'm sorry, given how much we know attitudes, touch points, and pain points are changing. How do we affect how does this affect customer journey efforts?
So is this, I don't know if this is specifically in consideration of the pandemic. I think in general.
That's true. When she asked it, I'm not too sure what this related to. That's a good question. So maybe this changing landscape could either be a movement more into digital health, or you're right, it could be the pandemic. Dr. Lisa, we're not totally sure what you're asking, so give us a follow-up question, and meanwhile, we'll answer Chinu's question. And Chinu is my friend who knows everything about chatbots. He says, what are your thoughts on the implementation of chatbots in the healthcare space?
I don't like them.
Me either.
So I've told
Sorry,
straight. Don't like them. So the reason why I don't like them is that, generally speaking, they're not being used with a true understanding of how patients deal with health seeking behaviors. So chatbots as a technology are amazing. Okay, just to put that out there. They really, when put to the right situation, are quite revolutionary. You know, there's a lot of times when if you just speak to a chatbot and it gives you the answer without having to call someone up, the cost associated with calling someone, the time of having to go through the voice messages and the like till you finally get to an operator, chatbots can be really useful. The problem with chatbots oftentimes in healthcare is that there's so many different ways that someone wants to express the medical problem that they have. You know, they are not a healthcare professional. They don't, say that they've got waxing and waning pain. They don't say that they've got,
I've got paresthesias.
See, you're familiar with this term. A lot of people wouldn't know. That's talking about pins and needles and the sensation of the numbness that you get in your fingers or in your toes, or if your leg falls asleep, so to speak. A lot of people don't use that terminology, and there's still times where chatbots are demanding someone writes medical terms, and it's like literally people go to medical school to learn this stuff. Why are you expecting the general public to know this? I think the other issue is there's a lot of times where when the chatbot tries to make a diagnosis and gets it wrong, it can actually be fatal.
Sure.
Or, which is still a serious problem to me, but not so much on a life and death issue, is that there's a lot of times where these chatbots will still encourage someone to seek a healthcare professional simply because of the legal implications of not getting someone to seek true healthcare assistance. And that's not always useful. There's a lot, and I mean a lot of diseases, do not require you to physically see a doctor. This is not me saying don't see a doctor. I'm saying there's a lot of diseases when you do eventually see them where if this was just a phone call, it would have been fine. You still could have been a serious condition, but the next stage of treatment or investigations or referral did not require physical face-to-face interaction with a healthcare professional. And chatbots are supposed to support in that area, but it's the nuances of what questions to ask to ensure that this patient is safe to be seen at home or has to urgently go to the hospital or needs to be expedited for surgery, so on and so forth. It just isn't at the level, at the skill of a trained healthcare professional, even trained straight out of medical school. And that's why I don't like them. When things go wrong, it's really bad.
Okay, we've got lots of questions. All right, I think we're going to end up going the full hour today. Thank you so much for all the people watching live and getting involved. So, Dr. Lisa's back, and she said, yes, pandemic related, but also the opportunities regarding digital health innovations and how patients want to engage moving forward. So, rolling back to her original question, she's asking about the changing landscape and how it should affect customer journey efforts, given what we know, given how much we know attitudes, touch points, and pain points are changing. Okay, customer journey in our new
Yeah, I suppose.
landscape.
Yeah, I think it's probably a bit of a commentary that I can offer to this rather than a specific answer. To me, I think a big problem that we're facing is that there is so much miscommunication on how to respond as a member of the general public for different countries that is causing a very confused decision-making process for people. You've got very, very specific guidance coming out of the likes of East Asia because of the nature of how they've locked down versus the US, which said a lockdown wasn't required. And now there's huge amount of, how things are across Europe. Where I am in Germany, we still have thousands of people who have died, but it's not tens of thousands. And we're still quite a large population. I think it's about 80 odd million people in Germany. And the UK is smaller by about 15, 20 million people, and there's a lot more deaths there. And the nature of where the UK is, you would have thought because it's landlocked, because it's an island, that actually it's only from people flying in. But we're surrounded by so many borders here in Germany. There's so many places people could have come in. We just haven't had as many deaths. But that's a whole other conversation about how COVID is.
That'll be on your podcast.
But specifically about the health-seeking behaviors and the customer journeys now, I see that there is a reluctance for people. I suspect there's a reluctance. I can't prove all of this, but I suspect there's a reluctance for people to seek healthcare provision because they either fear to get infected in the first place, or the second problem is they're worried that they could infect somebody else, so they'll rather just stay at home. And it's causing a lot of people to be even more isolated and delay getting treatment even more so than before. There's other people who are like, well, you know what, I'm not dying of this COVID-19. I'm going to go straight in to the hospital, to A&E, to wherever else. You then have other people who are, because of the confused messages going out, they think, well, actually, I'm young, and apparently young people don't die from COVID-19, which is the biggest load of nonsense that's probably come out of this whole pandemic. Is this
not the
false
biggest.
belief? One of the biggest. But this belief that you being young means that you're more likely to just fight the infection. You are more likely. But as really beautifully, I saw a Twitter post about this a few months back. Someone was saying how, well, if there's only 3% chance of dying, it's not that serious. And a young kid responded saying, well, if there's 100 Skittles and 3 of them could kill me in this bag, I'm not going to eat Skittles. And this is the reality. People can and will and have died from the pandemic, from COVID-19, and people are still thinking, let's just go out. I'm not going to actually get sick. And so this puts all kinds of pressures on the healthcare systems of different countries. And I think now that people are being encouraged to use telemedicine. Like I was speaking to a friend of mine in South Africa earlier on today. He's highlighted that he got a message, SMS, telling him, we're open for face-to-face and video conference consultations. And this to him was like a breakthrough. He's never heard of that in his whole life, in South Africa. And telemedicine is not overly prevalent in South Africa. And I think that's something that's going to start changing behaviors, is that there's now going to be there is a significant uptake in the use of telemedicine solutions, as well as chatbots and some sort of, decision support tools, or something that can help you just check your symptoms, so-called symptom checkers, check your symptoms to see, well, what diagnosis could I have? And then what would be the best next steps? Do I go see the doctor in a GP surgery through a video consult? Do I go straight to the hospital? So on and so forth. So I think the biggest issue at the moment is the confused message, which then increases the disparity of the different options people have and the actual health-seeking behaviors that they demonstrate.
Yeah, there's probably a
Hopefully
zillion
that answers
customer
the question.
journeys right now.
Yeah.
Chinu said, I'm a big believer in human-robot cooperation, but I agree with your points on the current issues with chatbots in a lot of spaces, including healthcare. Thanks for the response. Now, we've got 2 questions over in YouTube and another one over in LinkedIn. So over to YouTube, someone named Geek Gamer said, Dr. Giles, are you following any UX checklist while doing the discovery phase with patients?
This is a really, really good question. So I don't use a specific checklist, as in like someone else's. I actually created my own checklist, which is derived from basically the concept of what we call clerking patients. So when you go to the doctor and they ask you, what's actually bothering you today, doctors are trained to write that down as what you call the presenting complaint. So when you go to the doctor and you say, you know what, I think I'm having a problem with my heart, that's not what they write down as a presenting complaint. They normally say you got chest pain. And then they ask you more about the history. When did the pain start? When did it stop? They ask you about the medication you take, so on and so forth. And so we have basically a pro forma of specific headings that we write down. So I actually use something which I call UX clerking, which has got its own pro forma, which looks at key areas such as, well, what knowledge do we already have that we can be utilizing to work on this project? What technology solutions have already been utilized? Things like this. But it's used generically for any UX project. It's not just for when I'm dealing with patients, which I think was part of the question. I think with patients, what you're going to be following is ultimately based on why you're even interviewing them, or doing a focus group or any type of research with them. What you do as research techniques and questions that you're trying to have answered should always be derived from the brief. So a checklist can be useful, but I always feel that I can't just rely on one checklist for the whole of my research phase. It would only be to start a plan of action to get going. I'm not sure, what are your thoughts on that, Debbie? What's been your experiences when you do user research?
Totally agree. I mean, especially since I tend to have so many different projects, it's hard to say like, and these are the things I always ask, because I always have different
Yeah.
projects. And also those who know me and watch some of my videos will know I'm not much of a frameworks and canvases kind of girl. I'm not usually following somebody else's checklist or, hey, just fill in these boxes and you're doing UX discovery. So usually I'm thinking critically about each project, and I'm saying, what are we trying to learn, and what are good non-leading, non-biased questions that will help us get to know people better and help us get where we're going. But I don't want to talk too much. I'm going to let you do all the talking today. We have more questions. Niku asks if you could speak to some of the ethical challenges you have faced in designing for health.
Right, this is a really, really good question.
They're
So
all
to
good.
me, yeah, the topic of ethics is huge in healthcare UX, let alone clinical UX. Simply because the work you do could potentially impact whether someone lives or dies. And there was a project quite early in my career where I was working on a digital solution specifically to record the blood sugar readings of patients who go to the hospital. Now, blood sugar readings for a lot of patients who become inpatients at a hospital are going to be absolutely fine. Like if you don't already have diabetes, you're not having a terrible infection, you're not had a major trauma. Your blood sugars, as long as you're eating and drinking normally, shouldn't really change much. But there are going to be patients, such as those who are diabetic, who have severe trauma, if you're pregnant, if you're elderly, so on and so forth, where the blood sugar readings are going to be a very clear indicator that the patient is either deteriorating or getting better. So we have things like heart rate and blood pressure and stuff like that, but blood sugar readings for inpatients is really important. So I was faced with a situation where the digital solution was creating critical changes to the way the readings were being taken from the patient. So on the paper version, the doctor will say, or a specialist nurse will say, this is the normal reading that the patient should have, or the range of a normal reading for the patient. And then the nurse or healthcare assistant takes a blood sugar reading and then sees, is this number within the range or outside of the range? And particularly if it's below the range and this person's got a very low blood sugar, you're trying to give them extra sugar. And if the sugar is very high and there's a particular plan of action for that patient, you would probably give some sort of treatment or at least go and get the doctor or a specialist nurse or something like that. So the digital solution was asking the nurses now, general nurses or healthcare assistants, to do something beyond their training, beyond their responsibility, beyond their authority, which was to define the normal range for the patient, as well as recording the normal blood sugar reading for that patient as well, the most recent reading. So this is completely changing the workflow for the nurses. And the red flag for me is if you're telling someone to do something they've never done before, shouldn't normally do, haven't been trained to do, and it could kill somebody, they probably shouldn't do it. And I got a lot of pushback. Yeah, I got a lot of pushback from some of the management team that was dealing with that project. And I thought that it would be totally unethical for me to see that a patient could potentially die from our digital solution and not do anything about it. So I managed to grab about 4 or 5 hours of my day to get a quick mock-up of the solution, did an interactive prototype, created, I think it was 3 patient scenarios, and I got a bunch of doctors and nurses just to test it out, and I timed them. I said, this is the scenario for the patient, this is the normal blood sugar reading, please fill in this form. And what would otherwise be done on paper, because remember, all the nurse would do if they took a blood sugar reading is just put it in a box, either a white box because it's in the range or a red box because it's out of range. And then there will be some other escalation plan depending on what was going on, why the patient had a low or high blood sugar reading. It should take seconds. We're talking about putting a number in a box. That's it. It took over one particular case where a patient had actually had a higher blood sugar reading and they needed to have treatment. It took one of the staff members, one of the participants in the study, 3.5 minutes to fill in the form. It should have taken seconds. And even when they took so long, they incorrectly recorded it, which would have led to a deterioration in a real life situation. And thankfully, having done that test and presented the findings to some of the stakeholders for the project, they rejected the product, said we have to fix this. And of course, because try to be a good UX professional, I found an appropriate solution to this, but I had to have evidence that this could harm somebody. Otherwise, no one was going to fix it. And to me, I couldn't ethically see that there's a problem and not do anything about it. So that's probably the best example. Yeah, it shouldn't. It really shouldn't.
Okay, that's unfortunate. We've got a question. I'm going to do my best to make sense of this one. This is from new friend of the show, Honey, who joined in on our show this weekend, which made my boyfriend think I was talking to him because I kept saying Honey. So Honey, not my boyfriend. Honey guessed. She says, I had a question about an app the Indian government introduced for helping people in the pandemic. One feature of that app is it shows you how far you are from a COVID positive patient. patient. I wanted to
Mm.
know how an app would help in a country with this huge population. And then she says, and so less testing. I'm not sure what she means by that, but I'm guessing that her question in general is has to, I mean, we've heard about this in India. Now we're hearing about, I think, Apple and Google working on this, some sort of thing of trying to
Mhm.
say, like I remember in America they had apps like you live this far from a child molester. Now it's you're this far from
Yeah.
someone with COVID-19. That certainly opens ethical questions as well. But do you feel like that app is going to help more than it could be a questionable ethics?
I actually think it's more likely to do harm. Professionally, I'm very concerned about these solutions. The big reason why I see it as a problem is that people are already prejudiced. Let's just be really honest. It's part of human nature. We prejudge. It's how we decide whether we're safe or in harm's way. So we make a judgment call on what we see, gut reaction. Is this person likely to rob me? Is this some person I can trust to heal me right now? And this prejudice happens definitely during a pandemic. Even when I have to go to the shops, buy some groceries, there's people who are conscious that they need to be 2 meters away. But if I cough, if I sneeze, the fact that I didn't necessarily have a face mask, they're going to be extra cautious. And some people may even then discriminate. And that discrimination, that situation is the fact that they clearly turned around and walked back down the aisle to not be close to me. Or it could be, the dirty looks that I'm getting. And so let's just think that's what's happening when someone doesn't have an app. And now you'll have people who are, face down at the app as they're walking down the road, recognizes beeping or however it interacts to make you signify that there's someone who's positive around you. It's going to lead to people suddenly changing the way that they move around. Is that necessarily a good thing? There's people for sure, even just now, who are paranoid, who will not come out of their front door. They won't. They will insist everything comes to them. They're too afraid. There could be people, though, who, because of them using the app, realizes that actually Aldi or Walmart or whatever your local supermarket is, there's just too many positive people going there. I'm not gonna go anymore. There's actually too many positive people at the entrance of the hospital. So if I'm deteriorating, I'm not gonna go there. I think people are not necessarily going to use it as wisely, as expectedly as we are suggesting. Even if it's coming from the likes of Google and Apple who have made absolutely incredible products, I strongly fear that this could cause more harm than good. I think what we should really be doing is providing better advice and guidance, sometimes personalized advice and guidance to people on what to do during this outbreak, during this pandemic, rather than, oh, did you know that next door actually is full of a house with people with COVID-19?
Yeah, I mean, it makes me wonder a lot about where people get their advice from, which is obviously a
Yeah.
question you and I have asked each other many times in private messages. My boyfriend was telling me a story the other day that a mayor, I think, of a small village had passed away due to COVID-19. And
Mm.
evidently there was a public funeral with 200 people. And we're sitting here going, like, no words. Hello?
Yeah.
Did you not get the memo? And especially here in Italy, where we are locked down, all non-essential businesses
Yeah.
are closed. They're not even going to consider starting to open anything until May 3rd, though I would expect the lockdown to continue past May 3rd. I don't even know where people
Mm.
get these ideas that I think it's a cultural thing that I think the Italians can't imagine not holding a funeral for someone, and I can't imagine how emotionally difficult that is for someone to not hold a funeral for someone they cared about. And we still have to
Well,
not
yeah,
do it.
I think the big thing that comes to mind is the fact that people are social beings, generally speaking. Even if someone's an introvert, it doesn't mean they don't like spending time with people. It just means that they recuperate and they're energized by being alone. And so people instinctively want to be close to other people, particularly when they're suffering, which is the case of when you're grieving because someone's just died that you care about. But even like with the NHS, we've had this whole clap for carers, clap for the NHS, and literally people are congregating. Even healthcare professionals are congregating with patients and visitors to clap for the NHS. And I'm like, but you know that you're supposed to be socially, this whole social distancing is the way, one of the ways we can prevent the spread. And actually, you're just going against it because you feel that we need to celebrate. Actually, you need to still focus that the risk is real. Most people that get infected with COVID-19 are going to recover. And even a lot of people are not even going to be that sick. But it's those that do get really sick, it's those that do die, is the reason why we're doing all of this.
Yeah, I mean, I just saw an article before we started talking about someone's final hours on the phone with their father as their father is dying in a hospital somewhere and they can't be with him because he's in
Mm,
isolation in the hospital. If you are not too sure about the effects of this virus or the possibilities of this virus, go read all of those articles. If you are not
yeah.
crying and if you are not thinking about all of the people who will suffer because of the loss of the person who passed away,
Yeah.
it's so important for us to take this extremely seriously. I know you and I somehow end up here where this has gotten a little bit away from our clinical health universe. Let me check for questions. I think we do have a question, but thank you for that
Mhm.
answer about, these apps that are coming out. So, super friend of the show, Louie, who I hope to have on as a guest at some point, says, and this is kind of a variation of a question you were asked earlier, so I just don't know if you have anything more or different to add to it. He says, what principles or practices from the medical science could UX benefit from? I think it's a slight variation from what you were asked earlier.
Yeah.
So, low, kind of in
So
terms of practices.
yeah, I think a common thing that still is not as prevalent as it should be in healthcare is the concept of treating someone holistically. So there's a lot of times when we talk about patient-centered care, which is basically the same as user-centered design, the concept of keeping the patient's needs, wants, limitations, concerns at the center of the entire treatment process. But this concept of treating holistically, which is you understand that a person has a physical problem and the mental problems and the mental health and the physical health are intertwined, and the fact that actually these are affected by the people around them. This then gives rise to this concept of human centered design or people centered design. The fact that you might be making a product for the actual individual patient, but there's doctors that might be affected and other healthcare professionals, relatives, friends, loved ones, and the like. You know, this holistic attitude, holistic mindset is very, very useful. And I think we are seeing more and more UX professionals who just see that as that's the way you do good UX. You don't just think of, well, there's a persona, keep that persona happy, thinking, well, there's limiting users as well. There's people who might legitimately struggle to use your product who should be using your product. How can you make their life easier? Which there's a lot of times personas don't accommodate them. I think the other thing that comes to mind is this idea of working in a multidisciplinary team. So if you're working on a new product, or even if you're on an existing product that's being developed, um, you're going to be working with all kinds of different professionals, maybe data scientists, developers, graphic designers, UI designer, UX researcher, so on and so forth. And doctors and other healthcare professionals are used to this. They're used to working in a multidisciplinary team. And it's not a shock when they feel they have to work with other people who've got complementary skills to get the job done.
All right, Louis. He says that's what I wanted to hear, the holistic mindset. So, and that's also the advantage of watching in YouTube because the delay is about 20 seconds, whereas on LinkedIn it's about 2 minutes. Um, so, unfortunately, LinkedIn people, you are hearing stuff from 2 minutes ago, which is why I always suggest subscribing over on YouTube. It's not monetized, so you shouldn't be flooded with ads. Niku is back and says, considering the healthcare system is a long-standing system that may be resistant to change or new technology, how do you, physicians, and ultimately patients navigate that? Ooh, we don't have a
I think,
choice.
yeah, I think that's ultimately it. You don't really have a choice. Patients want to be well, but the general public want to be well, and they will generally put up with what they're given. If the healthcare solutions that are available are expensive and they can't afford it, then they simply won't access it, or they will do anything within their realm of influence to get the money to get that treatment. So it has huge impact on health-seeking behaviors if cost is a barrier. But if you're really sick, you're going to try and do something. You leverage what is available to you. The same sort of issues facing the clinicians. The vast majority of clinicians, even those in private practice, unless they are working on their own and they're in charge of their private healthcare practice, they are going to be almost slaves to the technology that is being given to them. The managers say, this is the electronic health record system you're going to use. This is the electronic prescribing software you're going to use to give medications to your patients. Get on with it, pretty much. And you can't really, as a doctor or other healthcare professional, be like, well, I'm just not going to use it, because then you can't do your job. And if you can't do your job, why are they paying you? So you get fired. So, you don't have a choice. Until you have the likes of healthcare professionals running hospitals, which is quite prevalent in certain parts of the world, you won't see the changes that you need until you get patients who have their voice heard at board level, at the level of people who truly hold the purse strings, which in some countries means being in the government, not so much just in the hospital level. Until you get the patients and the healthcare professionals higher up the pecking order, actually you're not going to get the changes that you need. That's my perspective.
Yeah. So, hey, everybody, we have been going for quite some time now. So, I want to just check in and see if there's any last questions, because normally we go no longer than an hour. And based on what I'm seeing on YouTube, some people don't watch more than 20 minutes. So, I'm wondering if I have to make these shorter. But there's always so many good questions. It's hard to make these shorter. Honey says, thank you for understanding the question. I apologize I couldn't put in the right words. No, honey, we got it. So
Right.
hopefully the answer was helpful. If you have any last questions, please ask them now. I'll ask you one last question, and I mean, other than COVID-19, which is an obvious worldwide priority right now, what do you feel are some of the other top priorities for digital health?
For sure, it's mental health. I think is a huge issue. Most mental health provision is ridiculously underfunded or simply has no funding, and digital can provide support for that, because sometimes mental health is simply about the fact that someone doesn't have the social interactions that they need, and this can have a huge negative impact on their mental well-being. So mental health is definitely a big area. Chronic diseases in general, specific ones would be chronic heart disease, diabetes, chronic kidney disease or lung disease, inflammatory bowel disease as well. There's quite a lot of diseases which, because of their chronic nature, no one's going to fully recover, but they could have a period of stability and just be rested and have a stable disease. This is a great opportunity for us to be working on. Hence why I mentioned earlier on in the live stream about the importance of digital therapeutics. But I think those perhaps is enough. There's lots of other things, but there's a huge amount of work to be done just in the digital therapeutic space for chronic health issues and for mental health.
Thank you. We've got a couple more comments. These are more comments, I think, than questions. Niku
Mhm.
says, "Love the long format. Thank you for this amazing live stream. Thank you for coming, Niku." Geek Gamer says, "How COVID pandemic is handled in London via digital solutions, since NHS and GPs have medication and medical records of all the citizens of UK, but still confused why they can't handle this pandemic." I'm not sure if that's commentary or a question. Well,
I think it's more of a commentary, to be honest, but ultimately it's leadership. If you're seeing issues with stuff like this, there is probably someone that's making decisions and they made the wrong one. That's my opinion on it.
I can't disagree. There's definitely many variations in leadership around countries, provinces and states, regions. There's many variations. But
Yeah.
we're not going to jump into that rabbit hole.
No, we're not.
I keep promising myself. So if anybody has any last questions, do ask. I'm just going to take 1 minute and do a little bit of reminders for people on what's coming up on our channel. So please remember that every Tuesday is live office hours. Ask me anything. If you've got any questions at all about CX or UX, that is 6:15 p.m. Italy time. Check your time zones. And of course, if you subscribe to YouTube and hit that bell icon, you'll know when I'm live. Then it's going to be a little quiet for a couple of days because I'm speaking at some online conferences and focused on that. And then next week, we've got a couple of podcasts coming at you. Monday, I'm going to be doing why the Lean UX book is such a giant disaster. Tuesday will be office hours, and Wednesday will be our rescheduled podcast with guest Michelle Ronson from Curiosity Tank on UX, resumes, portfolios, and interviews, which may or may not help everybody right now, but whatever she says is going to be good long-term advice. She is our resident expert on this stuff. So, in wrapping up, Dr. Giles, thank you so much for coming on, and I think you've got many new fans, so please tell everybody where they can find you on LinkedIn or Twitter or social media or some of your own streams.
Yeah, so I've kept it quite simple. Just Google Dr. Giles Morrison. Things come up quite quickly. So hopefully you find me on LinkedIn, my personal website. Also, I run the Clinical UX Association, so CUXA for short. So that's a global community of clinicians, UX professionals, IT professionals who are passionate about healthcare and clinical UX. So just head into clinicalux.org. You can find out more information from articles, webinars, and podcasts there. And that's all from me and from guests that I join in to that as well. So yeah, so basically just Google me. You should find me quite quickly, Dr. Giles Morrison.
Right, and find you on LinkedIn and follow you there as well.
Yeah.
Well, thank you again for joining us. I'm going to wind down the stream right now, but hope to see everybody soon. Again, everyone stay home, stay healthy, and I'll see you tomorrow at office hours. Thanks again, Dr. Giles.
Thank you. It's been a pleasure.
Thanks for watching. Delta CX is available for consulting and projects related to CX and UX strategy, leadership, training, problem finding, problem solving, and innovation. Learn more at deltacx.com.